What makes a speech therapy plan unique for CFS and ME cognitive profiles? Imagine trying to follow a map that keeps changing shape. That's what working with cognitive issues in chronic fatigue syndrome and myalgic encephalomyelitis feels like. These conditions cause a wide range of cognitive challenges that can shift day to day or even hour to hour. That's why speech therapy plans for these patients need to be carefully tailored and flexible. Unlike standard speech therapy, which often follows a set routine, therapy for CFS or ME must adapt to the person's current energy and cognitive state. One key reason for this is that symptoms like slowed thinking, trouble focusing, memory lapses, and difficulty planning can fluctuate greatly. Sometimes a person might feel relatively clear and able to engage, while other times fatigue or pain can make even simple tasks overwhelming. So, therapy plans must be designed to change as the patient's condition varies. This means therapists often create flexible schedules and modify goals based on how the patient is feeling that day. To do this effectively, speech-language pathologists need to perform comprehensive assessments. These evaluations look at many areas, including basic thinking skills like attention and orientation, language abilities such as naming and verbal fluency, as well as understanding and producing speech. They also assess visuospatial skills, memory, and higher-level thinking like problem-solving and judgment. By gathering this detailed picture, therapists can identify specific strengths and weaknesses and tailor interventions accordingly. Since fatigue plays such a big role in cognitive function in these conditions, therapy must include strategies for managing energy. This might involve teaching pacing techniques, scheduling sessions during times when the patient feels most alert, and encouraging energy conservation. The goal is to prevent overexertion that could worsen symptoms or trigger post-exertional malaise, a hallmark of CFS and ME. Another important aspect is addressing slowed processing speed and executive dysfunction. Patients often struggle with planning, organizing, and problem-solving. Therapy can help by teaching them external aids like planners or reminders, breaking tasks into smaller steps, and practicing problem-solving strategies. These tools help compensate for cognitive delays and improve daily functioning. Because cognitive performance can change from one day to the next, repeated assessments are crucial. Some evaluations might be done remotely or at home to monitor fluctuations over time. This ongoing monitoring allows therapists to adjust goals and strategies, ensuring the plan remains relevant and effective. A single assessment might not capture the full picture, so regular check-ins help keep therapy aligned with the patient's current needs. Goals in therapy are always personalized. Instead of focusing solely on test scores, the emphasis is on improving real-life communication and cognitive skills that matter most to the individual. Whether it's managing conversations, remembering appointments, or completing daily tasks, therapy aims to support what the person needs most. Finally, speech therapy for CFS and ME often works best when coordinated with other healthcare providers. A team approach that includes doctors, occupational therapists, and mental health professionals ensures that all aspects of the condition are addressed. This comprehensive care helps manage fatigue, mood, and physical symptoms alongside cognitive challenges. In summary, a speech therapy plan for CFS and ME is unique because it must be highly individualized, flexible, and attentive to fatigue. It addresses a broad range of fluctuating cognitive and linguistic issues with a focus on functional communication and energy management. This tailored approach recognizes the complex neurocognitive challenges these conditions present and aims to improve quality of life through personalized, adaptable strategies. Always remember, it's important to work with healthcare professionals to develop a plan that suits each person's specific situation.